Davao Regional Medical Center, formerly Davao Regional Hospital, is located in Apocon, Tagum City. It is a government tertiary training hospital that was established in 1972, initially as a 50-bed provincial hospital serving the population of Davao Province. In 1974, it started providing tertiary-level care, functioning as a regional hospital while still operating on a government budget and a human resource complement of a provincial hospital. On August 26, 2015, by virtue of the Republic Act 10678, signed by then President Benigno S. Aquino III, Davao Regional Hospital was converted into Davao Regional Medical Center, increasing its bed capacity from 300 to 600. At present, Davao Regional Medical Center is a Level 3 PhilHealth accredited facility which offers the following residency training programs.
True to its vision of producing a Filipino physician carrying every Filipino family, Davao Regional Medical Center, Department of Family and Community Medicine commits to Philippine Academy of Family Physicians mission, PEFP cares, and seeks to render excellent Filipino healthcare by striving optimum family practice and further aims to render comprehensive, patient-centered, family-focused, quality care post-grad training opportunities in the family medicine practice, advocates for the rights and welfare of families and communities, research and evidence-based practice, excellence in education and training in family medicine and its subspecialties, service for its members, train and develop government physicians in the field of family medicine, establish a training program that will provide opportunities for the establishment of a dynamic family medicine practice setup in the hospital and community, and develop government physicians who are able to provide continuing, comprehensive, personalized care to the patient and his family in the ambulatory, hospital, community setup, and ultimately achieving the goals of universal healthcare. Here at Davao Regional Medical Center, the Department of Family and Community Medicine always strives to achieve its goal, giving a patient-centered, family-focused type of care to all our patients. The pandemic we are currently battling right now challenges us to be more innovative, giving the best quality of care possible. Learning sessions scheduled regularly and held through virtual platform for our traditional residents as well as the practice-based residency training program from City Health, the nearby LGUs, and DTTPs in the whole Davao region. One of the goals of this program is to equip our trainees with a much-needed knowledge and updates on how to manage patients in a community setting and ultimately lessen the need of patients to be referred to tertiary institutions, hence significantly reducing the burden to be confined and exposed to a COVID-admitting hospital.
The Family Medicine Residency Training Program mainly aims to develop competent, compassionate, and board-eligible family physicians who can accept and render primary, total, comprehensive, and continuing medical care of the patient and other members of the family in various settings like community, hospital, school, and workplace. Assess the disease propensity of individuals, families, or communities, both in the physical and emotional spheres. Act as physician of first contact, know and discover the early signs of disease, and give proper advice and treatment. Utilize information technology and continuously be updated and seek improvement of practice through quality improvement activities. Act as family advisor or health educator and confidant of the family. Provide effective guidance of successful rehabilitation of patients from illness and a follow-through care. Become effective managers of healthcare resources and their own family medicine practice. Exhibit ethical practices, professionalism, and commit to various family medicine advocacies that will enhance the health and well-being of the patients, families, and communities. And lastly, be aware of current Department of Health programs and legal mandates that influence health.
During this pandemic, more than the issue on how to effectively protect ourselves with this deadly virus, our main concern as family physicians is how to extend and continue the medical service to the patients and their families. Davao Regional Medical Center, Department of Family and Community Medicine, opted to fulfill its commitment of serving the people by offering OPD virtual consultation. To date, the telemedicine program remained the safest interactive system between family clinicians and our patients. This year alone, we are able to cater an average of 990 virtual patients per month in our department, or around 21% of the average monthly census from all the medical departments of the hospital. Although there are still few challenges along the way, we are doing our best to give the optimal medical care and management we can offer to the family at the comfort and safety of their homes. We are humbled and full of gratitude to the positive feedback given to us by our virtual patients, expressing their thanks for still being able to seek consultation with a family doctor in these trying times. I dare say that due to this online consultation program we are offering, we are now able to extend medical help not only to the patients residing in or near Tagum City, but also to patients from different cities and regions as long as they have internet connection. To be able to cater and touch lives of families from all walks of life wherever they may be, despite the novelty of this new consultation platform, the Department of Family and Community Medicine remains steadfast and true to its vision of training and preparing a family physician that cares for every Filipino family.
Being one of the largest hospitals here in Davao del Norte, the Davao Regional Medical Center section of Palliative Medicine under the Department of Family and Community Medicine, established the Palliative Medicine Service in 2014, offering holistic service through alleviation of pain and suffering of individuals and families by addressing their physical, emotional, spiritual, and psychological issues, as well as hospice care through end-of-life care management, and also our service commits to provide our patients and families with quality of life.
Caring for the older adults has always been a strong cultural value for us Filipinos. Here at DRMC, Department of Family and Community Medicine, we understand that our older adult patients will require more attention given the usually complicated nature of their histories, medications, and comorbidities, not to mention the burden to the respective families if these patients become sick and in need of medical attention. Thus, we taught our residents through series of lectures on how to properly assess this elderly population, coming from the emergency room and at the virtual outpatient department. Hopefully, we will be having our geriatric center, which will cater to the geriatric population in Davao del Norte and other areas in Mindanao.
One of the advantages of DRMC Family and Community Medicine training is that the resident trainees have the unique opportunity to manage and refer patients with mental health issues directly to us consultant psychiatrists. DRMC, being located in Tagum City, Davao del Norte, receives patients with mental health concerns from all over Davao del Norte, Davao Oriental, and more. The nearest psychiatric hospital for patients in Mindanao, being in Davao del Sur, this is very difficult for a lot of our patients. And as we know, there are less than 500 practicing psychiatrists in the Philippines, with a big bulk practicing in the NCR. DRMC has been able to bridge the mental health gap not only through mental health professionals such as psychiatry consultants and psychologists, but also by training family and community medicine residents to be competent in managing mental health concerns both out at the outpatient and at the inpatient setting.
The Department of Family and Community Medicine continuously provides an ongoing, comprehensive health care for the patients and their families to assess and improve the quality of care, makes optimal use of new technologies, promotes healthy lifestyles, reconciles individual and community health requirements, and works efficiently in teams with other allied health institutions, thus putting forward the optimal medical care that is patient-centered, family-focused, and community-oriented while also training our resident doctors to become the best 5-star physicians we aspire them to be, worthy of becoming a Filipino family physician for every Filipino family.